All right, let me ask Commissioner Lockett. Commissioner Whiteley is here on Zoom, and Commissioner Kicklight is on Zoom. Am I correct?
Yes.
Okay.
Yes, sir.
All right, we're getting ready for the pre-meeting. All right. Uh, because of COVID, our minister will not be here today, but we're in position to take care of that. Okay. So we have the call to order, the invocation, and then we'll have the Pledge of Allegiance. I'm gonna ask Commissioner Milton to lead us in that. Then we will have the roll call, proclamations and special presentations. Okay. We'll get that done. Then we'll have the chairman's items that are on our agenda. No commissioner items, no table items. All right, items for individual action. Is there any commissioner who would like to ask questions about any?
Yes, sir, Mr. Chairman.
Okay, Commissioner Whiteley.
For item number 4, I just wanted to know what's the purpose of the surveys? And then additionally, what are the follow-on actions? Once we get the surveys, what are we going to do next?
Gotta turn your mic on.
What we do is we've got to go back, and this was done in the past. I want to think there's around 114 historic sites in the unincorporated area of Chatham County. We're going to resurvey and also add a couple others that have, been found over the last few years. So basically, it's a putting together a list, and once they do that, then we begin what I would say the real work of, do we need to improve signage, those kind of things.
Because,
So
go ahead.
is any of this associated with any potential developments in any of these areas? That's one of my constituents had a concern of that in saying that historically we'll see a survey or surveys of such nature take place. Maybe not necessarily historical surveys, but a survey nonetheless take place. And then next thing you know, here comes a new development. So
Yeah.
I would like to be able to quell any of that concern if possible.
Well, what happened is this will go into the process at MPC when staff and MPC board is looking at considering, a new project or rezoning or any of those things. Those certified, surveyed historic sites would be considered. And in other words, is it local, is it state, is it national? And it could impact development. You may have to, and an example is in Berwick, on South Bridge, the road right behind Kroger. I know we that are on MPC remember there is a historic gravestone, so that got kind of cut out. So that's what will happen. Do we, how do we protect those things, that type? But it is considered in the approval process.
Okay, thank you.
Okay, yes, sir.
Plus now, plus you can add to that too. Now we have the county's historic review board that we just appointed people to.
Yeah, that's what this group does.
That's a part of what they need to know. All right, and that will help to bring those members of that board up on where we are and what we need to do.
Yes.
All right, anything else on the individual item now? Commissioner Stone?
Thank you, Mr. Chairman. Under number 6, this resolution, I was trying to look up what exactly it is, and also does it have anything to do with, let's see, number 6 on the action calendar?
Yeah. I'm gonna get Nathaniel Panther, Mr. Chairman, from engineering to go over those.
Okay,
So, the grant is to do a feasibility study to see if it's feasible to collect and store rainwater to use as fire suppression on Birdside Island. You know, we don't have, fire suppression out there right now. But I'm not sure, what is the action?
The action calendar is a request for resolution for
Yeah.
postal incentive grant. That has nothing to
For
do.
green
I think they're
infrastructure,
separate.
that's totally separate.
Yeah,
So
the
they're
grant
not-
is completely
They're not
separate from
tied.
anything else.
No.
Okay, so explain to me, I think this is a great thing, so
Yeah.
explain to me exactly how, this would work, this, resolution.
Well, if approved, we would apply for the grant, and if awarded, it would be a study to see, is it feasible to collect and store rainwater to then use as fire suppression on some of our outward islands,
Alternatives.
but really focusing on Burnside Island.
So Burnside would be kind of like a pilot
Yes, ma'am.
Yeah.
project?
But the studies to see, is it feasible, where can we do it, how can we make it work? So that's all gonna come from
And
the
even
study.
dry hydrants that we talked about.
Yeah,
Okay, so I guess, because this is kind of intriguing to me, because they do have so many flooding issues. Where and how would you store the water?
that's to be determined. There could be tanks, there, you know, but the good thing is you're not using a potable water source. You're taking the rainwater that's causing the flooding, collecting it, and
Right.
then, it's water quality, you could improve drainage and flooding, and then now we're having a source for fire suppression. But again, it's just a study. If approved, the
Understand. I
grant's gonna
was-
give us all the details. That's why we don't have a lot of details in the agenda item.
I was just curious as to how and where you would store it. And
That
so-
would be, they would look
That'd
at
have to be
sites,
determined.
it could be tanks, that's all to be determined, Commissioner Stone.
Okay, thank you.
Yes, ma'am.
we gonna catch that rainwater and put it in a big bathtub.
That's,
Then when
Kinda,
we need it,
sorta.
then when we need it, all we gotta do is unplug it and let the water go where we need it to go.
And so where would that bathtub be stored?
That's what,
but
that's why the
part of
study is there, so
That-
we'll know
the
where
study
it need
is
to
gonna
be.
determine locations,
Right.
feasibility.
The whole thing.
It may not work, but if we get the grant, it will tell
No,
us.
I'm all for these ideas that sort of think outside of the box and,
Yeah.
and for an area in all seriousness that is prone to flooding
Right.
and is so low, I think it's an excellent idea. I just, as this progresses, if we get the grant, I would love to understand more of how you're going to accomplish this.
Sure. If we get the grant and as it comes along, we'll keep you all informed.
Thank you.
Yes, ma'am.
All right, anyone else got
Mr.
action?
Mr.
Yes, sir.
Chairman, we just got a notification from the court system. Judges who are on their way over, they start court and they're trying to not delay court. On number 3,
I got it. I got
they
it.
want it moved up.
I got it.
Okay, yeah,
got
they've
it.
called again.
That's why, I don't know if you saw me, but I was looking.
Uh-huh.
All right, and I
That's
thought
what
I
I was
saw,
doing.
I think I see 1 or 2, and some more might be coming. But, what they're talking about is item 3.
Mm-hmm.
We need to get the judges in here and out of here so they can get to court.
Yes.
All right, so I'm gonna make an adjustment in the agenda with that, okay? Yeah,
thank
I
you.
got it.
Thank you.
I got my note. All right, anyone else on the individual? All right. Under action? Is anyone,
Yes,
all
yes,
right,
sir, Mr. Chairman, number 7.
all right, number 7, go ahead.
So I'm going to request that we pull this from consideration today. I'm intimately aware of the Savannah Silver Cheetahs and some happenings, and I'd like to hear a little bit more about how we arrived to this conclusion. And I'd also like to find out if this is a continuation of the original. Is this that fifth year option for the original 4-year contract that was signed with them? So I'd like to, again, maybe get briefed about it a little more in detail after the meeting or
This
at
was
another
kinda-
time.
This is kinda going on for like 30 years.
Yeah,
isn't
it's really, I've got, if
Yeah.
I can.
Come on, come on,
Steve
explain.
Proper with
Give him the
Director of
give him the
Recreation.
details that he
Yeah,
would like.
that's long-term.
All right, that's right.
Yes, Commissioner Wiley. This has been going on probably for 30 years. Before the blueprint process, This is actually the contract that they were under. When we hired, Ms. Jennings, they went under the blueprint process. What happened was the leader and the founder, Coach Jinks, had very bad, medical issues, and so did his, second in command, and they missed the blueprint process, but it was already in my,
Budget.
already in my budget, so, that's where we are now, and we want to fund these kids. It's a very good program. It takes our kids that are interested in track locally, and it gives them exposure to AAU meets and all this type of thing. And also, we also fund a local meet that they have at Savannah State every year, and I think it's 25 or 30 years that's been in existence.
Yes, sir. So, thank you, Mr. Proper, for that, and I appreciate that explanation. Understanding that it's been 30 years that this has been going on, one question I beg is there anybody else who can offer this service, especially considering understanding the state of Mr. Jinks? Who's even running the organization now? Who's the last person we talked to? I know it's a great organization, and I'm very concerned, extremely concerned, considering it was the first nonprofit organization that I personally volunteered with as a college student.
Yeah.
I tried to sign my son up to run with them and was unable to
Really?
because they were not taking kids. And then I reached back out to, so my son runs for a club that practices elsewhere, AAU and USATF. Additionally, I reached back out as recent as October, and because I've had 7, 8, 9 different parents who want to get their kids involved, and I understood the agreement that we had with the Cheetahs, and unfortunately, I was told that we're not back out yet. And so I just want to make sure that with everything going on, that it's been happening for 30 years, so that perhaps we should throw it back out there for RFP, considering that ultimately this would be competing, or could technically be competing, with the City of Savannah Recreation Track and Field, but I know it rarely does it. I don't see the county actually putting that on, at least in the last few years, putting on a recreation program. So I understand the intent. However, I'm not necessarily sure that all of the players are as stable as we need to be, considering that, like you said, this happened for 30 years, and a large part of those 30 years was Coach Jinks. And as we all know, and pray for Coach Jinks, his recovery, Coach Jinks is not who we had been dealing with for the majority of, is not who we'd be dealing with now.
Yeah.
So who are we dealing with now? I think it's very important to know that.
I've been in close contact with the other people, Tara Smith, and there's other coaches that I've been in contact with. I had a couple of meetings with them. Also, at this late date and changing and putting an RFP process, I think we would lose a season of track and field for these kids that are already enrolled. I did not know about your son or anyone being turned away or that type of thing, or I would have talked to them. But they are organized. Coach Jinks left them a pretty good organization, and Tara Smith has been working with them probably last 10 years, I know, maybe even more. So she knows what's going on, and he has several coaches, 6 or 7 coaches, that know the nuts and bolts of the organization and are coaches coaching.
Mr. Chairman, staff, we don't have a problem in continuing for 2 weeks, and that way we can make sure we're covered, but staff agrees, let's just give it 2 weeks. Let's get some information to any board members that need that, and, yeah, that's not a problem.
And that won't affect what they're gonna
No,
do
sir,
anyway?
it will not.
Okay.
And for the record, we've already missed indoor track season, which
Yeah.
USATF and AAU does, has been running. I've traveled with my son running that.
Yeah.
Again, unfortunately, not with the Cheetahs. Mr. Proper, you shouldn't have to talk to them to run the program.
I agree. I agree.
But thank you, Mr. Manager, and thank you, Mr. Proper. I look forward to hearing some more about it.
Thank you, Commissioner.
Okay, yeah, Commissioner Stone.
Thank you, Mr. Chairman. I assume items 5 and 6 have to do with what we passed at a prior commission meeting to do with the districts for the fire
It's
zones?
the new 911 system.
Okay. I just want to make sure that I understood.
It's where
what it
they've
was.
agreed to partner with us. Those are partnering agreements, basically.
Okay.
Follow up with that, Mr. Manager.
Okay, when you're saying, it's just for, what'd you say, it was just,
On those two items, basically, it is agreements that they are participating in our record management system, our CAD system or computer-aided dispatch 911, and the connections between the two of us, and then sharing of information with all those organizations.
so is this going into the 911 system that
Yes.
we already got existing?
It's now and with the next one.
So have we made those improvements to the
The
down?
improvements are being made now. This is for the next generation system. And we're, in the next 18 months, be bringing that on board.
Thank you.
Anyone else from the action calendar? No commissioner? All right. After the action calendar, we don't have a first reader, we don't have a second reader. And then we have you should have copies of individual items that the managers and those anything we need to do now with that?
No, but I will be handing out, and I think we should have sent out electronically yesterday. There were questions about some of the ARPA submissions and additional information. We have submitted that. So any commissioners, when you take a look at it, we're trying to get a workshop together for the 10th of February, and we'll give you more detail and kind of walk through the first reporting from judicial, everybody that got ARPA money and what's going on. And everybody's doing a pretty good job, it appears. On, as the chairman says, backlog. I learned on that.
The law told me backlog. All right, stick with backlog. All right. Okay, so now, let me say this now, and this is for everyone's in here benefit. I would hope that while you're in here today, all right, and as commissioners and everyone else, please stay masked up, okay? We've had several on all 4 floors, employees who have tested positive, okay? And I myself had to retest yesterday to make sure, because I had come in contact with employees who were positive. So it's to your advantage and our advantage that you keep those masks on, okay? That's just a request for everyone who's in attendance in here today, all right? With that, I think I have, 9 minutes? All right, in 9 minutes, we will start the regular commission meeting.
All rise. Oyez, oyez, oyez. Silence is commanded by this honorable commission. All those having business, draw near.
Please bow your heads with me as we give the invocation. And then after the invocation, we will ask Commissioner Milton to lead us in the Pledge of Allegiance. Most holy and everlasting Father, our God, it is in the holy and precious name of your Son, Jesus Christ, that we thank you this day for allowing us the health and strength to gather here in the commission room. And as we go about doing the business of Chatham County, we ask that your Holy Spirit lead us and guide us, that we make those decisions which are beneficial to all citizens of Chatham County. Bless us in our going out and bless in our coming in. In Jesus' name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
with liberty, justice for all. Thank you. You may be seated. Again, let me make, this is a request that everyone who is in attendance, please wear your mask. We've had numerous members of the staff in this building who have turned positive during this week. And so we want to make sure that we're covered, okay? So we ask, if you will, go along with us and please wear your mask while we're in attendance here. Let us have roll call. Just tap it.
Okay. Chester A. Ellis, Chairman.
Present.
Kenneth A. Adams, District 8 Vice Chairman.
Present.
Helen L. Stone, District 1 Chairman Pro Tem.
Present.
Larry Gator Rivers, District 2. Bobby Lockett, District 3.
Here.
Patrick K. Farrell, District 4.
Here.
Tanya Milton, District 5.
Present.
Aaron Whiteley, District 6.
Here.
Dean Kicklighter, District 7.
Here.
Thank you.
Thank you, ma'am. Let me now ask, I need to make a slight adjustment in our agenda. I want to go to individual actions, all right, because we have several of the judges here and we need to get them in and out. So I'm gonna go back to our presentations and proclamations, but first I want to get this done so that we can get the judges back to the court on time. Request board approval of the resolution declaring Chatham County Detention Center as a temporary alternative courthouse facility. Is there a motion?
So moved.
Been properly motion and second that we approve the request coming from the board. Now, any of the judges want to speak? If so, come on forward.
Good morning.
Good morning.
Judge Colbert and I are here just to see if there were any questions about the request. It looks like the request was approved, and we appreciate the fact that the commission has moved so quickly to approve this. It's going to help us move some of the backlog that we have based upon COVID. We're trying to get the courtrooms in the jail up and operating, and we're able to do that with live streaming, and we appreciate the time that y'all spent on this.
All right, any questions from? All right, no questions? Commissioner Kicklighter, how do you vote?
Yes.
Commissioner Whiteley?
Yes.
Okay, all the others? All right, thank you.
Thank you, everybody.
And
Thank you for
I'm
your time.
glad they sent the judge that's famous.
You put me on TV today.
That's my good friend now. He and I go back.
It's
All
a
right.
win-win situation.
Yeah. Okay. All right, now they can get back to their duty and we can go back. Let us now go back to proclamations and special presentation, and Dr. Ruskin is here.
Thank you. So good morning, everyone.
morning.
Chairman, thank you for allowing me to be here to give this update. It is always a pleasure to be in front of this board. Right now, you know, at the previous meeting, I believe the percentage of Omicron spreading was probably in the 70–80%. As of now, pretty much everything that's coronavirus related is Omicron. At this point, it's the CDC reports that 99% of all cases are associated with this particular variant that we're currently dealing with. As I stated at the previous meeting, the transmission rate of this particular variant is the highest we've ever seen, so it doesn't surprise me that there's individuals that have been exposed here in this building and other buildings. To start off with, again, the sort of the top line numbers for vaccinations in Georgia and Chatham County, and as you can see, Georgia as a whole administered over 14 million, broke that 14 million mark this past week in total vaccines, and still at 62% with one dose and 54% of Georgians fully vaccinated. In Chatham County, we've seen an increase since the last commissioners meeting of about 6,000, a little over 6,000 total vaccines administered since the last meeting. That's broken out into roughly 1,350 new doses, so new people that has received their first dose. Over 1,200 individuals that have become fully vaccinated, so they received their second dose if they took a 2-dose series. Not a lot of changes in percentages. The numbers aren't moving high enough to really move those percentages. We did increase to 54%, so we're in line with the state. And over 3,600 individuals received a booster dose since our last commission meeting. And so the numbers are moving up. They're moving slowly, but they are moving up slightly and when it comes to vaccinations. The next chart is our rolling 7-day rolling average of new cases. I do want to point out a couple of things on this particular graph. The wave that preceded this Omicron wave between the August and September peaked at around 306 average new cases in a week. We peaked around 778 just recently. But I do want to caveat that peak with a couple of things that everyone needs to understand. The graph does show a decline here, and what we're seeing is more of a plateauing effect, because this is average cases. If we was to overlay every day, you would see this going up and down, this particular graph. But what I want to make sure everyone understands is that these are reported test results. They reported through getting a PCR test, which is you get a swab that goes off to the laboratory, your results come back. We do not receive rapid test results. At-home rapid test results are not reported. And we know there's been an increase in rapid testing. And so that's not reflected in the data. That's not reported to the department. There's not a mechanism to report those rapid at-home tests. And so it's really difficult to say yet if we're seeing a true decline, because we know there's so much transmission in the community. A lot of that is being tested with the rapid at-home test. So I just want to caveat that these are encouraging numbers, but we have to continue to monitor those. The next graph shows the number of cases in a week. I kind of moved this around to kind of put it next to the rolling average graph. This just gives you an idea of the number of cases we've seen in the last week, new cases. It actually adds up to over 4,500 cases. So we're still seeing a lot of cases of coronavirus in Chatham County. The age ranges are at the bottom, and we're seeing the majority of our increases in that 10 to 50 age range. The next graph is our community transmission index, and it's somewhat stabilized, or at least plateaued. At the previous commissioners meeting, that first bar is actually the day of the previous commissioners meeting. We were at 2,883 cases per 100,000. We're currently, as of yesterday, at 2,917. So actually a little bit slightly higher than the previous commissioners' meeting. We did peak at 3,400 a few weeks ago or a few days ago. But again, we're still in a very high transmission category, the highest we've ever seen. Even the day's numbers are the highest than the previous peaks that we've seen over the entire spectrum of this pandemic response. The next graph is just a historic graph to give you perspective on the peaks of the community transmission index. You can see the previous waves, the Delta wave preceding this Omicron. At our lowest between Delta and Omicron, we were at around 68 cases per 100,000. And we peaked, at least for now, at 3,400. But again, this data is a result of reported data. So it's primarily based on PCR testing that is reported to the Department of Public Health. The next graph is our testing graph. We are still testing a lot of people, but those numbers have declined. Testing has actually declined at our test sites pretty significantly. Over the last 3 weeks, during the week of January 10th through the 16th, the health department sites tested over 5,800 people. Last week, we tested around 3,900 people, and this week, we're, as of yesterday, it only tested around 1,380. And so as you can see, just looking at the graph, the numbers are coming down for testing. We do still offer testing at both of our sites. The public health sites are at the Savannah Civic Center, and our West Chatham site is on the Georgia Tech campus at 210 Technology Circle. Those sites are open at least 5 days a week. We alternate every other Saturday at the Civic Center, and the West Chatham site is open every Saturday in the morning times. And so there's ample opportunity if people need to be tested. And then there's also the other options for testing in the community at pharmacies, hospitals. And a lot of folks have ordered the rapid at-home test, and so some individuals have that ability to test at home as well. With testing, even though we don't receive rapid test results, the at-home results, we do strongly encourage the public to follow the recommendations if they test positive and isolate themselves as best as they can from people to prevent continued spread within their own home and within the community as well. The percent positivity data, as you can see, is still pretty high. I mean, we had dropped down into the 2 to 3% positivity. This particular graph is as of January 21st. The data that comes in is usually over a 2-week period. But I did look in the system, and right now our average 2-week percent positivity is around 32%. So it's still really high for the folks that are being tested. And that's reflective in all the other numbers I presented. The cases are high. Community transmission is high, which you would expect the percent positivity to be high as well. The next slide is our hospitalization slide, and we have seen increases since the last commission meeting. There's still a lot of folks in the hospital that's being treated or has COVID in the hospital that's exacerbating another condition. Again, these numbers are not as high as they were during the Delta. We do know that clinically, this particular variant doesn't seem to have as high of a clinical issue as the Delta, but it does still cause significant issues in certain individuals, and it does obviously cause hospitalizations. And so, we provide these statistics just for monitoring purposes, and the hospitals are doing, the best they can. The one thing that I hear repeatedly is hospitals are struggling, like with many organizations, with staffing, being able to have adequate staffing to be able to adequately care for patients that are in the hospital. Because we're seeing so many cases, even though the clinical outcomes of this particular variant are in some cases, not all cases, less severe as the previous variant, just the sheer number of cases, again, is going to result in high hospitalizations. And so that's why you see the hospitalization numbers creeping up as they will. There is, I believe, Chairman Ellis, you had asked me at the last meeting about what are treatment options that are available. There's still, options that are available that are not hospitalized, but hospitalized options. The monoclonal antibodies are potentially available if you meet certain clinical criteria. If you're so sick that you're eventually hospitalized, they don't administer that in the hospital. The goal is to keep you out of the hospital. So if your physician feels you need that, they try to get that in you before it leads to a potential hospitalization. And essentially, it's just a synthetic antibody that stimulates your immune system to fight the virus. There's also some of the antivirals, the oral pills that have recently been approved. There's 2 antivirals that are approved, but all of these options are very limited in supply. That's the biggest concern. Nationally, the manufacturers have not been able to keep up with the demand, given the number of cases that they've seen across the country. And so Georgia is on an allocation, meaning Georgia as a state receives a certain amount of these various treatment options, and then they're allocated out either to the various hospitals or pharmacies across the state, but they're in very limited numbers. And so there's really only 2 really good monoclonal antibodies that is effective against this particular variant that's available right now to patients, and it's in limited supply. Which goes back to just, anything we can do to protect ourselves and prevent ourselves from being in a position that we may need that is important, because it is very limited. There is treatment options when it comes to preventing hospitalizations, but due to supply and demand, limited. The next slide is just a graphic of our Chatham students by age range. If you look across this graph, we have it graphed back to early August to kind of show you the Delta wave, which started in August, and you can see the increases in cases among children. And then that really sharp decline between around September to mid-December. And then you can see the very fast increase in cases in these age groups as we hit right after Christmas and into January. Again, just reflective of the high transmission level of this particular variant. The high-level statistics, cumulatively, Chatham has reported over 57,000 cases since the beginning. It's an increase of over 9,000 cases since our last meeting here. And since our last meeting, there's been an additional 12 deaths added due to COVID, unfortunately. What are the takeaways? Again, I know I sound like a broken record, but a couple of takeaways. Obviously, we recommend vaccinations. They are monoclonal antibodies, oral antivirals are not a replacement for that. They are a treatment, but if you can prevent it, if you can prevent going to the hospital, that's the best approach. And so we are recommending that again, and our sites are open. There's more options for vaccinations in the community than there ever was. If someone wants to get vaccinated, there's plenty of vaccine out in the community. Obviously, wearing masks when appropriate, indoor settings, crowded settings, is still important. A well-fitted mask is important. Washing hands and socially distancing, really the same message to try to blunt the spread as much as possible is our best tools that we can use. And then the last takeaway is that while we continue to monitor the data and we see sort of a plateauing or stabilizing of the numbers of the cases, we do need to be mindful that folks who test at home those data don't get reported. They don't show up in these statistics. And so there could continue to be spread in the community. And if you're sick, if you test yourself, you test positive, even if you test negative, if you have symptoms, you can consider yourself potentially positive and should treat and isolate accordingly just to try to prevent continued spread of that. So with that, I'll take any questions on the update.
Okay. Commissioner Milton, anyone else? Okay, Commissioner Milton.
Thank you, sir. Thank you for your presentation. Just, you were talking about the pill, the preventive or the medication, I guess, to keep you from getting so sick. How's that obtained? Is that with a prescription or?
The antiviral pills are with a prescription.
Okay.
It's like Tamiflu. If you get the flu, your physician can write a prescription. But the medication is at limited number of pharmacies and in limited supply. It's because there just isn't enough to go around, and they're ramping up production nationally, but every state only receives a certain amount from the federal government.
Thank you.
Commissioner Adams.
Yes, sir, Doctor. How often is that pill taken?
I don't have the prescription guidelines in front of me, so I honestly don't know exactly the treatment regimen, but I can get that information for you.
Thank you.
Commissioner Wiley or Kicklight, any questions?
No, sir, Mr. Chairman.
No, sir, Mr. Chairman.
All right. Thank you, sir.
All right, thank you.
All right. Let me now call on Commissioner Milton as she gets ready to take us to our next agenda item.
Thank you, Mr. Chairman. It gives me great honor to acknowledge the anniversary of the Mighty 8th Air Force Museum, or the Mighty 8th Air Force. I have a proclamation here that I'd like to read, and I'll read it now. It starts, it's whereas the Chatham County Board of Commissioners recognizes the many sacrifices made in order to protect the United States of America and its allies, and in that spirit, we pay homage to the 8th Air Force. And whereas the U.S. Army Air Force activated the 8th Air Force on January 28, 1942, in a former National Guard armory that was located at 1108 Bull Street here in Savannah, Chatham County, Georgia, and while serving during World War II, earned a reputation as a great war-fighting organization. And whereas during World War II, under the leadership of such generals as Ira Ecker and Jimmy Doolittle, the 8th Air Force formed the greatest air armada in history. And by mid-1944, the unit had a total strength of more than 200,000 people, and it could send more than 2,000 four-engine bombers and 1,000 fighters on a single mission against enemy targets. And for this reason, the 8th Air Force is commonly known as the Mighty 8th. And whereas from May 1942 to July 1945, the 8th planned and precisely executed America's daylight strategic bombing campaigns against Nazi-occupied Europe, and in doing so, the organization compiled an impressive war record. However, the record carried a high price, for the 8th suffered about half of the U.S. Army Air Force casualties. Now, therefore, I, Chester Ellis, of course, Chairman, on behalf of the Chatham County Board of Commissioners, do hereby proclaim Friday, January 28, 2022, as the 8th Air Force Day in Chatham County, and applaud with great pride and appreciation the courage, character, and patriotism displayed by the men and women of the 8th Air Force from World War II to the present time. In witness whereof, I have hereunder set my hand and caused the seal of Chatham County, Georgia, to be affixed this 28th day of January 2022. Congratulations. The representatives from the Mighty 8th.
Let me call on the President and CEO from the Mighty 8th to receive and any comments.
May I make a few, Mr.
Yes, sir.
Chairman?
You sure
Chairman
shall.
Ellis, members of the commission, Commissioner Milton, thank
Thank
you very much. This recognition for our nation's most storied Air Force, the Mighty 8th, activated 80 years ago today, just a few short blocks from where we are now, is certainly appreciated. However, the history of the Mighty 8th and the lessons of extraordinary courage, character, sacrifice, and commitment may have been lost were it not for your predecessors, for an earlier commissioned body that forged a relationship with 8th Air Force veterans some 30 years ago to establish the Mighty 8th Museum here in West Chatham County, in a place that at that time was pretty desolate, pretty empty, and today much has grown up around the museum and, of course, all of West Chatham County. For 3 decades, the Chatham County Commission and the museum have enjoyed a true public-private partnership that has produced a public good. And so for this proclamation, I say thank you on behalf of the museum, on behalf of all those who have served and continue to serve in the mighty 8th Air Force. We're grateful for the proclamation, but especially grateful for the partnership that the two entities continue to enjoy. Thank you so much.
Thank you.
Thank you.
And I'll share my personal story of the Mighty Eighth. When the Mighty Eighth Museum first opened, I was invited out. I had attended several banquets out there, and I was invited out by the chef to come and enjoy lunch, and I did, and I had crab cakes, and they were the best crab cakes that I had ever had. And shortly after that, that chef became my husband. And I'm still eating crab cakes.
We
So
conduct marriages, too.
congratulations.
We're about romance too. Thank you.
Thank you
That
so
says
much.
a lot about your crab cakes.
You connecting dots. All right, thank you so much. Let me call on Commissioner Farrell.
Thank you, Mr. Chairman. At this time, I see we have some guests in the audience from Benedictine Military School, and I would ask that they come and join us around the podium to be recognized with this proclamation. All right, before us today is the state champion sports shooting team from Benedictine Military School. I'll read this proclamation into the record. Whereas Benedictine Military School is a Catholic Benedictine college preparatory school which forms and educates young men from diverse backgrounds, supports a deeper commitment to their faith, prepares them for life through a quality academic program, and instills leadership skills through a junior ROTC program, athletics, extracurricular activities, and community service. And whereas Chatham County is fortunate to have this educational facility that seeks to form men of virtue and integrity through instruction and discipline, to prepare them for lifelong learning and service to their faith and civic communities. Whereas on Friday and Saturday, November 19th and 20th, the year 2021, at the GISA Sport Shooting State Championship held at Forest City Gun Club in Savannah, Chatham County, Georgia, the Benedictine Cadets Sport Shooting Team won the state championship in the GIS General Division with a combined score of 1,379 targets hit out of 1,500 thrown. The 5 shooters whose scores contributed to this total are Walker Brooks, Pete Hodge, Jack Kinlaw, Drake Cooper, and Jackson Schaff. Jackson Schaff shot a 292 out of 300 targets, which made Jackson the high overall individual state champion in the GISA General Division, and also the highest individual score in any division in the entire state of Georgia. The other members of the 2021 Cadets Sports Shooting Team, which contributed to the team's success, are Will Marsh, Chase Farrell, Jake Dykes, Jackson Furlan, Charlie Moody, Whit Watson, Walker Zadar, John Adams, and Hayden Keller. Now therefore, Chester A. Ellis, Chairman, on behalf of the Chatham County Board of Commissioners, do hereby congratulate Benedictine Military School Sport Shooting Team for winning the state championship and applaud Benedictine Cadets head shooting coach Howard J. Morrison III as well as coaches Chuck Dixon, Jeff Kinlaw, Barrett Schaff, Doreen Cooper, and Brennan Lemieux for their skills and leadership, making it possible for Benedictine Sports Shooting Team to achieve this high honor. And is signed the 28th of January, 2022. So let me congratulate the team, the school, and these 5 top shooters that are before us today. They exude the competitive spirit, the will to succeed, the discipline instilled with the leadership of a group of volunteer coaches that work with these young men. Unfortunately, we're due to some of the medical circumstances surrounding our county today, the rest of the team is not present to participate in this. Hopefully they'll be watching this on film. But you talk about a program that has only been in existence for less than 5 years to come out, and not only did they win the state championship this year, they won it last year, and another Benedictine student was the highest overall shooter. That means out of every competitive shooter in the state of Georgia, Benedictine has produced the 2 top teams and the 2 top individuals, which is absolutely incredible, in my opinion. At this time, I'd like to recognize the head volunteer coach of the shooters, Howard Morrison III. I'm sure you're all very familiar with his late father, who was up here often in many different community endeavors to improve our county. So Howard, would you like to introduce your top 5 and tell us a little bit about the experience?
Absolutely. We started on a hot August day in
Mike's not working.
we started on a hot August day, and I asked these young men to do their best and to work diligently. They did that throughout the season, and all of them showed up and did their absolute best at the state championship, which is what we needed to secure the win. These scores are outstanding scores. 1379 out of 1500 is really top notch, and I'm proud of all the kids, especially Jackson Schaff, who only missed 8 targets out of 300 to win high overall for the state. But Pete Hodge also should be noted, was 4th in the state. He did a fantastic job as well, but all of them did. And we have with us today Mr. Lemieux, Pete Hodge, Walker Brooks, Jake Kinlaw, Jackson Schaff, and Drake Cooper. And I just want to thank the county commissioners and these fine young men for helping us be here today.
Let me say to all of you tonight, whether they give you credit or not, you started a trend. Because after you won last year, then the baseball team won, and the Georgia Bulldogs won, and we on a winning streak. The football team won, so we just need to keep this thing going. All right, so congratulations for what you've done. Now, there are the individual certificates are on the desk right there. Make sure, Coach, you take them with you. And best of luck, and any way we can support, let us know. Thank you so much.
And keep up the good work.
Keep it up.
Yeah, it's very encouraging to see high school athletes. It's very encouraging to see the high school athletes to excel and do great things and work towards goals and make those achievements. And the county commission, I speak for myself and I think for all of us up here, we applaud and like to show what great things our youth and throughout the community are accomplishing.
Thank you. getting ready now for a presentation on the Chatham County Safety Net Plan in council by Executive Director Reginald Lee. Mr. Lee, if you will come forward, and do we have his presentation? All right. Mr. Lee, before you start, and let me tell you, we're on a timetable, okay?
Yeah, 10 minutes.
All right.
I've been
All right.
practicing.
Okay.
Yes,
Okay.
thank you,
No
Mr.
problem.
Chairman. Again, good morning, Chairman Ellis, Chatham
morning.
County Commissioners, and county leadership. On behalf of our board chair, Dr. Mark Johnson, our board of directors and staff of the Planning Council, I'm pleased to have an opportunity to provide an update regarding the funded activities of the Chatham County Safety Net Planning Council. The Planning Council is guided by its mission, vision, and values. Our mission is being to enhance the healthcare continuum by assisting to strengthen service-based efforts through public and private partnerships, develop an infrastructure, and increase capacity to maximize access and utilization of affordable healthcare services, including primary, behavioral, and oral health care. Our vision is ensuring all uninsured and underinsured Chatham County residents have access to affordable health care. Both our mission and vision are guided by our values, which seek to find, promote, and advocate for effective ways to increase access to health services and never lose sight of our purpose and those we serve. The Planning Council achieves its mission, goals, and values by working in collaboration with a diverse group of community partners as listed before you. We strive to build a healthier, safer, trauma-informed community. While serving as a linkage to our community partners as they provide needed primary, behavioral, and oral health care. The Planning Council is appreciative of the funding support from the Chatham County Commission, which includes funding for planning for infrastructure improvements and capacity building for efficient and cost-effective delivery of primary health, oral health, and behavioral health care by our partners. Facilitating partnerships between health and human service organizations for the delivery of health services, including the development of the Chatham County Child and Adolescent Behavioral Health Directory. Recruitment of local health providers for membership in Health Information Exchange called GRACI, the Georgia Regional Academic Community Health Information Exchange. And finally, delivering community evidence-based prevention and safety and resilience programs, including Prevent Suicide Today, Applied Intervention Skills Training, Suicide Talk, and Mindful Self-Compassion. Local private membership in GRACI has been a success because of commission funding. This funding has allowed for local health organizations to connect seamlessly with healthcare providers across the local community and throughout Georgia by connecting and sharing patient healthcare information, allowing real-time patient care information, and reducing unnecessary tests and services. Additional successes in GRACI include 226 organizations in Georgia with a connection to GRACI, including our local partners listed on this slide. During our reporting period, over 26,000 new patients had their health medical information uploaded to GRACI. 177,000 existing patients had additional healthcare information uploaded to GRACI, and local healthcare organizations shared each other's patient information over 9,500 times. Other Chatham County funded programs include our suicide prevention and our upstream safety and resilience evidence-based programs. Through these programs, we utilize best practices to create a suicide-preventing, trauma-informed community by developing and implementing our programs that address physical, emotional, and mental well-being. Our safety and resilience programs aim to meet our community needs for effective, accessible, and affordable resources and training in 4 areas, including suicide prevention, trauma-informed practices, emotional well-being, and resilience building. These training programs and workshops are offered to Chatham County residents free of charge because of county funding. This slide reflects additional evidence-based community-wide programs offered by the Planning Council, again, including our Mindful Self-Compassion program, our trauma-sensitive yoga, Front Porch Acts program, which Commissioner Rivers attended our recent Front Porch Acts graduation of students from the Youth Intercept program. Additional safety and resilience information is available from the Planning Council's website. Additional program outcomes from Chatham County funded safety and resilience programs, including the following successes. Over 200 people trained in applied suicide intervention skills training, over 5,000 people trained in suicide awareness, over 13 people trained in mindful self-compassion, over 700 people trained in trauma-sensitive yoga, and over 500 people received trauma drama training. An additional 335 people received trauma-sensitive interaction and community resilience model training. Outcome data from the Planning Council's National Suicide Prevention Awareness Month activities held in September are included on this slide. Activities included a digital billboard on Duran and Bull Street, alerting the public that suicide is preventable and providing local and national resource information, including the Suicide Prevention Lifeline telephone number. A live stream suicide talk training hosted by Mayor Van Johnson and facilitated by my colleague Vera Selsburn. Our program director was viewed by over 2,000 people. We are also appreciative of the acknowledgement from the commissioners with a proclamation during National Suicide Prevention Awareness. Additional program outcome information and grant awards for our safety and resilience programs is listed on this slide. As stated earlier, our planning efforts center around infrastructure improvements and capacity building for efficient and cost-effective delivery of primary behavioral and oral health care services offered by our safety net partners. During our funding cycle, the Planning Council led a group of local citizens in a needs assessment process to assist the Planning Council in better understanding the oral health care needs of citizens of Chatham County. Data provided a clear indication of the need for an oral health campaign in our community. 56% of adults 18 and over reported not seeing a dentist in the past 12 months. 22% of adults 65 and older had lost all their teeth. 72% of adults 18 and over reported having no dental insurance, while 11% reported using emergency rooms for dental care. Additionally, based on our results of the needs assessment, the following recommendations were made by the Oral Health Initiative Committee, including increasing access to oral health care and eliminate disparities, including providing free dental services, prevent disease while promoting good oral health practices, increasing the dissemination of oral health information and improving oral health literacy of our citizens, and integrate oral health and primary health care, and lastly, advance oral health public policy and research. An oral health community event was a tangible result of the oral health needs assessment. This picture represents services during our August 2021 event. And we had the privilege of having Commissioner Lockett attend that event as well. Outcomes for our oral health event included 174 patients served, over $77,000 in value of their dental care, with 191 extractions, 39 fillings, 48 cleanings, 144 oral health screening exams were conducted. Local media outlets, including WTOC, WSAV, Fox 28, and Agenda Latina, covered this event. We are only successful in meeting the primary behavioral and oral health needs of Chatham County citizens because of partnerships with the following agencies and governments, and they're listed on this slide. The Planning Council also seeks to inform and educate the community about healthcare options and to provide healthcare information. We are embarking on a Did You Know campaign that's intended to inform the community regarding the high cost of non-emergency care at local emergency rooms, direct citizens to other healthcare options for non-emergency care, and inform citizens that using non-emergency care options will save time and money. We hope to print the brochure in mid-February with distribution at local emergency rooms, health centers, free clinics, nonprofit agencies, through Chatham EMS, churches, libraries, and other places where people congregate. The Did You Know campaign brochure, the Did You Know brochure will be used in tandem with our community health resource brochure, and I provided the commissioner's copy of those brochures. We're also working to actively disseminate oral health practice information, including dental health resource cards, how to maintain a marvelous mouth handout with instructions on how to conduct a self-oral cancer exam. We will continue to add oral health information throughout this year, as well as piloting a school-based program called Brush Breaks. Our marketing materials will be printed in both English and Spanish. Over the past several months, I should say, the Planning Council has been revising our strategic plan for the next 3 years with emphasis on the 3 bullet points on this slide. Expanding community partnerships and initiatives guided by the Chatham County Blueprint, specifically addressing mental health and ensuring access and investment in community-based health resources. We're also going to increase collaboration with new and existing partners, including the recent Chatham County funded free dental program of the Savannah Volunteer Dental Clinic. Developing a strategic integrated marketing campaign to include but not limited to, again, dissemination of our community health resource brochures, dissemination of the Did You Know brochure, holding a second annual clinic event late fall or late summer, I should say, or early fall, and expanding and leveraging resources for Planning Council programs and initiatives. And finally, although not part of the Planning Council program presentation today, we have included Safety Net provider data for your review in your binder. Thank you, Mr. Chairman. I'll be happy to answer any questions.
Any questions from any commissioner? All right, Commissioner Stone, I see.
It's not,
Milton.
thank you, Mr. Chairman. It's not a question, it's just a comment. I'm very, very grateful to see that you all are addressing the needs for mental health along with everybody else in this community that's trying to work on this issue, because it's not getting better at this point.
Great, thank you.
Thank you, Mr. Chairman.
All right, Commissioner Milton.
Thank you, Mr. Chairman. I just want to say kudos to you. I know the program that you did during the August, during your oral health, I think that was a very good success, and hopefully you can continue to provide those services.
Thank you. We're looking forward to it. And again, could not do anything without the support of the commission and the partners that we listed on the slide.
Thank you very much.
Thank you.
Commissioner Lockett.
Thank you, sir, for that great presentation.
Thank you.
Do you have an idea what date y'all will be doing the oral clinic this year?
We were hoping to do it in the fall, but I've been in contact with our partner, Remote Area Medical, and they're on dates available. The only date they have is August date, so we're looking at that, and I hope to make an announcement about that in the next couple of weeks.
Be looking forward to it. Thank you.
Okay, thank you again for attending.
Anything from commissioners, Whiteley and Kicklighter?
No, sir.
I did have one question, Mr. Chairman.
Go ahead.
And so, thank you, sir, for that presentation. I saw on that last slide where you, it mentioned partnering with different organizations to kind of expand. Have you already identified some of those that you were looking to potentially work with?
You mean in terms of our just programming in general?
Yes, sir, and whatever the context was on that last slide.
Yes, we have a number of organizations we're working with, including local nonprofits. I'm actually just joined a coalition with a health fair with the African American Resource Center. So we do have additional organizations like the 100 Black Men that we'll be reaching out to. But yes, there is a list to answer your question.
Okay,
and if
cool.
if
All right,
you have
thank you.
somebody that we should be talking with, please feel free to reach out to me through email or telephone. We'll be happy to connect with those organizations.
Absolutely. Thank you, sir.
Okay.
All right. Thank you,
Okay.
sir.
Thank you, Commissioner.
Appreciate you. Now we will call on the manager, who will introduce our HR director for our Employee Service Awards.
Yes, sir. You know, still with the pandemic, we are still doing electronic and AV for our Employee Service Awards. So at this time, I'd like to call up Carolyn Smalls, our Director of Human Resources, to give that presentation, please.
Thank you, County Manager Smith. Good morning, Chairman Ellis.
Good morning.
Commissioners. We are beginning our 2022 Employee Service Award recognitions on a strong note. You may recall that we ended 2021 with recognizing just 8 team members, probably the smallest group we have ever had. Today, we're recognizing 23 team members, which will be one of the larger groups we will have this year. And there's a lot to be said for starting out strong. And the strength is not just in the numbers being recognized here today. The strength is in the talent that they bring to the table. It's in the service they provide to our residents. The strength is in the teamwork and the collaboration that make them Team Chatham. And it's also in the dedication and the hard work they bring to the job. So today, let's celebrate all that makes them strong, individually and collectively, as we move forward through 2022. And let's build on it in the days and the years ahead. Now, as you watch the presentation today, you will see some people you know, and you will certainly recognize a few honorees near the end of the presentation. Just a little heads up about that. So with that, please join me in recognizing and celebrating our January 2022 Employee Service Award recipients. Congratulations, Chairman Ellis, and congratulations, Commissioner Lockett, on your service milestone, and congratulations to all of our team members on achieving this recognition today. We thank all of you and thank them for their dedicated service to Chatham County, and we look forward to their continued contributions to Team Chatham. Thank you very much.
And thank you, ma'am. Appreciate it so much. All right, we'll move on to chairman's items. Under the organizational items, we have the election of Commissioner Vice Chair Kenneth Adams. Is there a motion?
So moved, Mr. Chair.
Properly motion and second that Vice Chair Kenneth Adams be elected. Are you ready for the question? Please vote. Commissioner Kicklighter, how do you vote?
Yes.
Commissioner Whiteley?
Yes.
Okay. Okay, we're missing Commissioner Lockett.
Oh, I'm sorry, sir.
Okay, all votes are in. All right. Part B, elect Chairman Pro Tem Ellen L. Stone. Is there a motion?
I so move.
Second.
Properly motion and second. Are you ready for the vote? Commissioner Whiteley, how do you vote?
Yes.
Commissioner Kicklighter, how do you vote?
Yes.
All right. Thank you. All right, there are no commissioner items, no table items. We go to items for individual action. Vote bold appointment. Appoint Cedric Coleman to the Metropolitan Planning Commission. Is there a motion?
I so move, Mr. Chairman.
Properly motion and second that Mr. Coleman be appointed to the Metropolitan Planning Commission. Ready for the question? Please vote. Commissioner Milton,
Yes.
Commissioner Whiteley votes yes. Commissioner Kicklighter?
Yes.
Commissioner Kicklighter votes yes. Okay. Request approval of the following budget amendments and transfers in the Special Service Districts. Appropriate $5,000, fund balance. B, increase revenue, $661,963 in the insurance premium tax revenue. C, transfer $5,661,963 to the Fire District Fund. 2, in the Fire District Fund, increase revenue and expenditures, $5,661, $963 to establish an operating budget. Is there a motion?
So moved.
5 million. $5 million. You got a move?
Second.
I believe there was a statement that it was 5,000 for the
I'm
first
sorry,
item.
5 million. If I said 1,000, that's my bad.
That would be a,
Yeah, let's keep, cause these glasses keep fogging up, but 5 million, not 5,000, now 5 million. All right, there's a motion. Second.
Second.
All right, Commissioner Whiteley, how do you vote?
Yes.
Commissioner Kicklighter, how do you vote?
Yes.
All right, all votes are in. All right, request board approval of a resolution supporting grant applications for the unincorporated Chatham County Historic Resource Survey, Phase 1. Is there a motion?
Mr. Chairman, I move we support the, approve the resolution as shown in the packet.
All right, it's been properly motioned and second that the board receives approval. Are you ready for the question? Please vote.
Hey, point of order.
All right, yes,
Point of
sir.
order. Did we just skip number 3 or did it cut out? I didn't hear it.
No, we moved number 3 earlier because the judges were here.
Okay. Thank you. I just saw it go to 4 real quick.
Okay, yeah, we moved number 3 up earlier because the judges had to come in and get back to court.
Yes, on my part here.
Okay, everybody, well, let's vote.
Yes.
3. Five to zero.
Mr. Chairman, Commissioner Whiteley votes yes.
All right, I have you and I have Commissioner, I was just waiting on Commissioner Lockett. We got him in now.
He's ahead of the game.
All right. All right. 5, request board approval of a resolution as presented to apply for a coastal incentive grant for green infrastructure, low-impact design structure, and committal upon award of the grant, enter into a project agreement with the Georgia Department of Natural Resources Coastal Resources Division. Is there a motion?
So moved.
Second.
Properly motion and second that the request be granted. Are you ready for the question? Commissioner Whiteley, how do you vote?
Yes.
Commissioner Kicklighter, how do you vote?
Yes.
Okay, waiting on the chairman. All right, everybody's in. Request for a social worker's position in the Chatham County Office of Children Advocates, previously referred to as juvenile
Wait a minute, you skipped number 6.
I skipped number 6?
Yes.
Oh, I'm sorry. Let me go back. Request board approval of resolution as presented to apply for a coastal incentive grant for a fire suppression system for the Burnside Island and commit upon award of the grant to enter into a project agreement with the Georgia Department of Natural Resources, Coastal Regional Resource Division.
Mr. Chairman, I move, but I would like, for the purpose of the viewing audience, if just a brief explanation can be given on this, because I think it's a wonderful project.
Okay, let's get the motion then first, and then we can get that.
I made the motion.
Okay, give me a second. Properly motion and second, that it be approved. Now, let's get the, now let's get the, Nathaniel's gone, isn't he?
Yeah, I can take care of it.
Yeah.
Okay.
Just a brief explanation.
Okay. We've been looking at issues of fire suppression, and we've been looking at some pilot programs. And this is a good area that staff agreed because of rainwater, stormwater runoff, the possibilities of not just dry hydrants in areas, but storage of water from stormwater runoff, so you accomplish two things at once. Having water for suppression plus water storage, hopefully to reduce some runoff and flooding issues for residents and businesses. So we're excited about it. We're hoping that this will bring about possibilities for other areas of the county. So this will be the first pilot project. So we've got a couple of great things out at Burnside. We also have, I call it the Muscle Project, that for stabilization of the causeway is underway right now. So we're, again, very excited about both of these programs. We'll probably be some of the first on the coast of Georgia. So.
Yes.
All right. All right, please cast your votes. Commissioner Kicklighter, how do you vote?
Yes.
Commissioner Whiteley, how do you vote?
Yes.
Okay. Request board approve a resolution as presented to apply for a coastal incentive grant for the fire suppression system. Oh, that's, I just did that.
That's what you
We just did that.
All right, I'm getting on.
Number 7.
Let
Number
me clear
7.
my glasses so I can get straight here. Hold on. All right, now they unfold. Request a social worker's position in the Chatham County Office of the Children Advocacy, previously referred to as Juvenile Indigent Defense Unit, funded by a grant through the Georgia Office of Children Advocacy and the Georgia Department of Human Resources. Is there a motion?
I so move.
Second.
Properly motion and second that the request be granted. Are you ready for the question?
Yes.
Commissioner Kicklighter votes yes. Commissioner Whiteley?
Yes.
Votes yes. Okay. All votes are in. Now we get down to chief. All right, the Chatham County Police Department.
Thank you, Abby. Good morning, everybody.
Good morning.
Just a couple things before I get started on the presentation. Commissioner Whiteley, myself and some of my staff did go out and meet with Mr. Patel out there at his hotel at 20495, kind of did a walkthrough, giving him some suggestions relative to make it a little bit of a safer environment, and we had a very good meeting. Commissioner Milton referenced the trucks that are on Girard. I did send a letter from my letterhead to the company asking them to cease and desist using that as a training ground for their truck drivers. I did not hear anything back. I'm not sure if you've had any other complaints since then.
No other complaints, but they did acknowledge the fact that they had not seen any more of those trucks training on Garrard Avenue.
Okay, well, good.
Thank you very much.
You're very welcome.
Get on file.
And Commissioner Adams, the Lights On program with Mr. Patterson, myself and the county attorney had met just to look over the MOU. He was fine with it, so I'll get some more information on that as we go forward and get signatures on that and stuff. So I just want to give you an update on that project. All right, no problem.
And also, too, they did acknowledge the fact that the weight, the maximum weight levels, the sign that displayed all of that information, which was all the way to the back of Garrard Avenue, has now been placed to Chatham Parkway and Garrard Avenue.
Okay, excellent.
So that means that they can see the sign now.
Okay.
Thank you very much.
You're very welcome. What I will do when I go through, in the interest of your time, since you've had multiple presentations here this morning, this is kind of a yearly 2021 kind of capturing everything. But when we get to the maps, I'm just going to go through, kind of fast forward through those. It really just kind of displays where the crime has happened, which is what I do, at every presentation. But I think we can fast forward those today, if you don't mind. Looking at, this reflects, going back all the way to 2016, this Tuesday will be 4 years from our reestablishment of the county police department. So 18, thank you. 18 would have been our almost full year of policing the unincorporated parts of Chatham County, and then obviously the crime reflects where we've gone forward. We have seen some increases, and I'll talk through those as we go through the presentation. As you look in 2021, in the rape, sodomy category, 31 out of 38 of those incidents did involve suspects known to the victims, which is generally the case, unfortunately. Get into assaults with guns, 87, 36 involved shots fired with 11 victims being struck. 4 by firearm, 47 were only pointing gun in a threatening manner. Commercial burglaries were up during 2021. Mail and package thefts increased substantially. Total crime was up 14.2% above 2020, but below 4% below 2019. We look at 2020 as an anomaly, as a COVID year in which more people were home. They were stuck at home. Crime reduced substantially across the country in that year. Here are overall 2021 crime stats. Again, property crimes increased from 2020, but if we took out 2020 as the anomaly, we are still a trajectory downward from when we started in 2018. So I think we're doing relatively well, trying to contain things and be as proactive as we can in the midst of having limited capacity and staffing shortages that we've been experienced most recently. Here reflecting the violent crimes, again, increased by, from 2020, 39.4%, which kind of trends nationally. Domestic aggravated assaults and homicides, non-domestic, we did not have any domestic homicides in 2021. We did have non-domestic aggravated assaults, 124, and then 3 robberies. We had 60. So obviously very concerning to us relative to the increase in violent crime. Trying to wrap our arms around it. Again, most of those are aggravated assaults. And we're going to get to a slide later on that shows in which kind of road rage incidents and people pointing firearms at people when they get into disagreements out there on the road. Firearm-related assaults from 2019 to 2021, the number of times a gun was pointed in a threatening manner increased from 18 to 24 to 47. From 19 to 21, the number of times a gun was discharged at a victim increased from 22 to 31 to 36. Obviously, firearms are prevalent in society. I certainly support the Second Amendment, but with that becomes a great responsibility. And we're going to get to the number of firearms that were stolen out of unlocked vehicles, which is a continuous problem in Chatham County, not only in unincorporated, but certainly in the city as well. Here are the road rage assaults, use of firearms 16, firearm pointed in a threatening manner, vehicle used as a weapon where a pedestrian was hit or an occupied vehicle rammed. These are all around aggressive driving, people getting upset about the aggressive driving, and it's just, I can tell you anecdotally, just driving in this county, because I have an unmarked vehicles, that the manner in which people drive in the aggressive way is just appalling to me. Probably those type of complaints, traffic-related complaints, speeding-related complaints are probably our number one or number two most common complaint throughout the county. Here are the location of the road rage with guns, mostly on the west side. You can see the red dots. We did have a couple on the east side, one on Islands Expressway and one on Debbie Street and 80. Property crimes, again, increased by 14.2% from 2020, but again, we're 4% below 2019. And here are the Part 1 crimes by precinct. So the east side tends to have lower incidence, about 563 last year. West side was 1,131 total Part 1 crimes, so a little more than half on the west side as opposed to the east side. Firearms stolen from vehicles, as I had mentioned, we had 73 stolen from 68 vehicles, and only 5 of those incidents where a window was broken. These are unlocked vehicles where people are leaving their firearms in there. We've done PSAs, we've put signs in neighborhoods. I at least done 4 or 5 interviews with the media relative to this. We're just going to keep attacking it in that way and try to educate and inform, and hopefully folks start taking a little bit more care in their firearms. I tend to think that the firearm becomes normalized within folks' vehicles, much like your registration or your umbrella or whatever else you keep, in your car on a normal day-to-day basis, and folks like to have their firearm in their vehicle, but then it just becomes kind of part of the normal everyday contents. We're in a rush, we get out of our car, we're trying to get groceries in the house, or whatever it is that we're doing, and we forget to lock our vehicles. But then you become a victim, and that firearm goes out into this community or even goes into other states, and we don't recover many of them. And oftentimes when we do, it's many years later. So, we'll just keep asking the public to please be a responsible gun owner. If you need to keep it in your vehicle, please lock your vehicle.
Commissioner Middleton wants to ask you before you leave this particular slide.
Yes, ma'am.
Just, thank you, Mr. Chairman. When you recover these guns that have been stolen from unlocked vehicles, and do you return them back to the owners?
We have to return them to the owners.
So when you return them to the owners, do they give you an explanation as to why their car was unlocked?
Generally, it's much of which I said. Some will say, well, I locked my vehicle, but there's no forced entry into their vehicle, their window isn't smashed. But they generally say, I forgot, I was in a hurry, that's really the general explanation that we get.
Do you find that any of these victims are repeat? Have they had their gun stolen more than once out of an unlocked car?
I have not seen that.
Okay.
I do think they take the warning, or at least the experience, and tend to be more careful.
Thank you.
Yes, ma'am.
All right, Commissioner Lockett.
Thank you, Mr. Chairman. Chief, I want to just say this. You mentioned earlier about the signs in the neighborhood. I am beginning to see them all over the 3rd District, and we are very glad for that. And especially when you mentioned about the speeding and the breaking into the cars. But those signs are all over the 3rd District, and we're glad to see them.
Thank you, sir.
Mr. Chairman,
Yes, sir.
in reference to that existing slide, can I,
Sure.
can I have it, please, sir?
Go right ahead.
Thank you, sir. Chief, thank you. Quick question, and I pose this to you and perhaps my colleagues. As Commissioner Milton, talked about when we're returning these guns to these gun owners, when it was left in a unlocked vehicle, the explanation, I wondered, could we potentially enforce a fee or something like that? So whenever we're returning it back to them, an administrative fee or something like that, for that return, maybe to, on a policy level, try to create some negative reinforcement for leaving your car unlocked with a gun in it?
Mr. Chairman, we don't have an answer. We'll pose that with the county attorney and the
That's a
chief.
legal question, yeah.
Okay, we'll do that and get back with you.
Yeah, that was my thought, that's a legal question.
It is.
We'll get back with you as soon as we get with the attorney. Commissioner
All right, thank you.
Whiting. Okay.
Thank you. Moving on, this is just an overview of the beats and the total part-1 crimes. I'm gonna, for the year, those are aggregate throughout the year. I'm gonna rush through these here real quick. Get to, everyone's favorite subject, the school zone cameras. We will be adding additional locations. As you can see, our Southwest Middle School, St. James Catholic School, Hess Elementary, and Isle of Hope Elementary. I know Commissioner Farrell had gotten some emails from some constituents on the Wilmington Island area thinking, wondering why they were the only ones that had cameras. It's a very laborious process to implement the cameras, and you have to run through GDOT. We have county engineering involved, so there wasn't any rhyme or reason why we started out on the east side, other than we were able to get the permitting done quicker and things of that nature. So it is a process, and these, we will do plenty of public education. We've added, as you can see on this picture, we've added the speed zone, or the speedometer signs, so people know how fast they're going. We've tried to be as communicative and give as much public education as we can relative to the cameras. Just some community engagement we've done towards the end of the year. We had Pack the Bag. You can see we're with the Sheriff's Office, Savannah PD, as well as ourselves, getting together stuffed animals that we can give out to children out there during our work. We work really well with the Sheriff's Office, really well with Savannah PD. They're great partners of ours. So I'm just thankful to Sheriff Wilcher and Chief Minter for our relationship and how we go about policing this community. Shop with a Cop, that's where we partner a police officer up with a child with donated funds, and they're able to go through and usually it's about a $100 gift card, and they can go Christmas shopping for themselves and or their family, mom, dad, brothers, sisters, and it's a great event. I tell you that I think the police officers get more out of it than the children. It really kind of helps their spirit. And this is another Shop with a Cop with Ronald McDonald House. We had Tybee PD there, Savannah PD, and it was just a really great experience. These are our community contacts for 2021. We had 5,000 that we were able to identify, 5,537 citizen contacts throughout the entire unincorporated Chatham County. So that's officers not there on a call, just getting out of their car, engaging the public, engaging the business owner, saying hi, how can we help, how you doing? And again, that's such a great exchange of goodwill between the community and the officers. I think we both benefit from that tremendously. And last but not least is I wanted to capture, so about a month ago, Officer Joseph Robertson, in 2 consecutive shifts, saved a life on each shift. And so it just struck me as, wow, what a day, what a 24-hour period. So we went back and looked at, his call log and all that he did in that 2-day period. And this kind of highlights not every single thing that he did, but just try to get down at the grassroots level of what our officers do on a day-to-day basis. I mean, the real police work that they do. As you can see, He started his shift in the evening, conducted building checks. He had a behavioral health call where a person was transported to EMS. Then he was dispatched as a primary officer to the report of a person with a gun. Then he conducted some building checks, assisted a motorist. Then he was dispatched as a backup officer to a suicide, so he helped manage that scene, conducted more building checks. Then he was dispatched to a hit and run. He spotted a car near the scene that was smoking. As he approached, he saw the car was on fire. He didn't realize it was occupied at the time. There was no other first responders on scene at the time. Officer Robertson managed to get the driver, who was on fire. His clothing was on fire. So Officer Robertson, to my understanding, he busted out the back window, reached in, pulled him from the front to the back and out the side, and then tried to roll him around to extinguish his clothing that was on fire. The driver did live, but he did have burns over 80% of his 80% of his body. And then he clocked out and went home. You know? So think of that. You know, you experience all that throughout that shift, and you don't just go home and kind of put your head down and go to sleep. You know, your adrenaline's up, you got a lot going through your mind. But then he gets up the next day, he comes in, starts his shift again, handled a moving traffic violation, alarm call, conducted, again, building checks, responded to a report of a suspicious vehicle. Then he was dispatched to the call of an unresponsive female believed to be suffering a drug overdose. Officer Robertson detected a pulse. She wasn't breathing. He administered Narcan. Saved her life. Then he got done with that. He spotted an impaired driver, conducted a traffic stop, and made a DUI arrest. So that officer that citizen wasn't out driving drunk, potentially injuring themselves or someone else. And then he worked some hotspot prevention patrols, checked buildings, suspicious vehicles, and was dispatched to a 911 hang-up, and then he went home. So in 2 days, he saved 2 lives, maybe more, with the arrest of a drunk driver. So I really just tried to, you know, it just struck me as a way to kind of, one, thank Officer Robertson for his dedication and hard work that day, and really just try to highlight, you know, those officers are out there every single day doing this type of work. And I really appreciate their dedication, their stick-to-itness. I mean, we are thinly staffed right now, and they're coming in every day doing the good work that we ask them to do. So I want to thank Officer Robertson and every officer of Chatham County Police Department for the work that they do. And we'll continue to do the best that we can with your support, the manager's support. We just really benefit from all of you, quite frankly. And I just want to say thank you. I'll be happy to answer any questions that you have.
All right, do we have any questions? All right, I see Commissioner Adams at 8. Do I see anyone else?
Yes, sir.
Commissioner Whiteley or, hold on, Commissioner Whiteley or Kicklighter, any questions?
No, sir.
Okay. All right, Commissioner Adams.
Thank you, Mr. Chair. Chief, on these unlocked vehicles with firearms in them, is it in a specific district or is it all over the county?
It's all over the county, sir. I don't think there's any one area of the county that tends to see more of them than others. They're pretty much everywhere. And we've thought about, you know, what could you possibly do, but what we don't want to do, if you put sanctions, people won't report them stolen, and then we don't know they're stolen. So there's kind of that kind of aspect to that, so.
Anything else?
Thank you, sir.
Yes, sir.
Let me ask, this might be a question for the manager as well. In Officer Roberts' case, that's going above and beyond. All right, from this commission, we need to make special recognition of that when officers do that. Saving 2 lives in 2 days. And in fact, saving 2 lives in 24 hours. It's not even 2 days, is it?
Yeah, that's correct, sir. Yep.
All right, so we need to recognize that.
I would ask the chief, you know, obviously, this is one officer.
Give
and
you
we've
some
had others, so
recommendation.
if we could get those, I think it'd be great to recognize.
Let him,
Yeah.
give us your recommendation on what we
Yes.
can do.
Okay.
It'll be just like when we give recognition for milestones or employees. So, you know, within a 24-hour period, you done saved 2 lives. That's not ordinary. That's not every day.
That's
All right,
correct.
so that comes above and beyond to me.
Yeah, we'll get something together with the manager's office and
Okay,
PIO.
and then get it back to us.
Yes, sir.
All right?
Absolutely. Thank you.
Thank you. Thank you, sir.
All right, thank you. Y'all have a good weekend.
Appreciate it. Same to you.
Thank you, sir.
On the
Mr. Chairman,
action.
I have a question
Yes, sir.
for the chief.
Go ahead.
All right, so thanks for the presentation, Chief, and I applaud what you all are doing. I know recognizing that Beach 7, 8, and 9 saw the highest level, of course, probably more populous as it relates to the unincorporated area, so that's understandable. But are there any long-term goals in place that we could try to address that? And additionally, I know y'all can't do that on your own, so what could we as a commission do to kind of help taper this? And I'll go to another extent. Do you think us increasing, whether it be code enforcement, business license enforcement, and health standards would maybe help with any of these issues that we're seeing?
To respond to your last statement, yes, I think that there's oftentimes that it isn't necessarily a law enforcement response, meaning arrests, tickets, citations that we can administer that solve the problem. Case in point, the Scottish Inn out there, obviously we brought in the Department of Health. They came in and did what they do, and unfortunately we had to shut down the business, but it was the right thing to do, which really damped down the amount of activity that was occurring there almost on a daily basis. So I think partnering with Department of Health, looking at strengthening, code enforcement or the capacity for code enforcement and addressing it in a very comprehensive manner can certainly, number one, have an impact on the amount of times we have to go out there, but it also, I think, sends a message to the business owners that we're going to, have standards, that we're going to ask you to comply with those standards for the quality of life, not only for the folks that visit around there, but the neighborhoods that adjoin, that business district.
All right, well, awesome. And then the last question I have is, so the adjacent areas, I know when you give us a report, it is, of course, of the unincorporated area, but when we're looking at whether it be the maps or just generally speaking, there are adjacent areas that fall under different jurisdictions. And so I'm curious to know, again, whether we could, I'm not sure if that would be with you all or if this is a discussion for the manager, but how can we get a more holistic view of crime in our areas? Because of course, when we look at it, it can look real bad in the unincorporated area, but if the crux of it is in an adjacent jurisdiction, then perhaps, under the One Chatham vision, we should be talking with our fellow municipalities about how we can, again, work to quell some of these issues.
Yeah, I do think there's opportunities as we go forward to work more cohesively with the other jurisdictions that we butt up against, specifically the area that you're referencing. Obviously, you got Savannah. There is some areas that are city of Savannah jurisdiction. So there's definitely opportunities that we need to capitalize on as we go forward. Our biggest challenge right now is staffing. It's just staffing. I'm just going to be, really blunt about that. I know in talking with Chief Mentor yesterday, in fact, we were in a meeting with the manager and other city and county leaders around homelessness, which affects that area out there as well. When Savannah PD 60, 70 officers light, we're 22 down right now. Sheriff's Office obviously has their challenges, and all the other jurisdictions that are really challenged in terms of trying to be at least 95% staffed. The way we are now, we are in a reactive proposition. I hate to say that, but it's the truth. So we're working really closely with Human Resources. We have some meetings set up. They've been fantastic. Trying to think of some strategies to attract candidates and keep candidates here so we can get to a point where we can be proactive in addressing some of our issues, whether it be collectively with the other jurisdictions or independently on our own, where we can make a difference in this community. But when you're running thin and you're just answering calls for service, it's just hard. It's very hard. So, but there's hope. I think the pendulum's going to swing. I think we're going to do better as we go forward. But I do think, thank you. I think it prompts me, Commissioner, to get together with the city of Savannah, maybe Garden City and others to say, what can we do, even in the midst of our current environment, what can we do collectively in some of these problem areas that we share, you know, very closely, to make a more of a difference.
Well, thank you, Chief, and I just want you to know that your work is appreciated, and I'm not trying to come down at all. I'm just trying to be proactive. I believe that reducing the factors that attribute to crime fall on us as a commission, and then enforcement falls on you all, and so that's a partnership that has to be, you know, fostered as we continue to grow and build our community. Mr. Manager, I'll just ask that you please take note of those, the comments that were made up to this point as we approach budget, making sure that our departments, whether it be code enforcement, business, and so on and so forth, are adequately staffed. As I know, again, I'm not naive to the fact that staffing is an issue for all of us. So I do understand that. I just want to make sure we have some plans in place and are prepared to support the different departments within our organization that will help Chief and our fine law enforcement do their job. So thank you again, y'all.
Thank you, Commissioner.
All right. All right, let us now go to the action calendar, and we're going to take off out of the action calendar number 7, right? Okay, so can I have a motion to accept the action calendar in its entirety except for number 7?
So moved, Mr. Chairman.
Second.
Properly motion is second that we accept the action calendar in its entirety except for number 7. Are you ready for the question? Please cast your vote. Commissioner Whiteley, how do you
Yes.
vote? Commissioner Kicklighter votes yes. Commissioner Whiteley votes yes. All right, and we have everyone else, okay? No first readers, no second readers, and now we come to items for individual action. Information, yeah.
Yes,
I mean,
sir.
I'm sorry, information.
Yeah, I'm not gonna go, you've got a brief report.
Okay,
The other thing is, we are trying to schedule, January, it's amazing, it's already February. Our first of a series of workshops for the board. We're looking at February 10th, if you could look at your calendars and let us know, from 10 a.m. until 12, and then we'll have lunch. We want to go over questions about ARPA, give you a report where we are so far, and bring in 2 or 3 departments and let them describe what they do so you'll know more about services and what they do and some impacts that we're having with the economy and some other stuff, but also service changes. So we'd like to do that starting on February 10th.
Is that the only date you have available? Okay, we'll have to get together.
Okay.
all right,
Yeah, it's tough to find.
yeah, let's, because
Yeah,
February, from beginning in February and running through March, it's gonna be tough,
it is.
right? Because there's some things going
But I
on.
know,
and
yeah,
then-
during budget last year,
then
a lot
after-
wanted to hear more.
Yeah, then after March, then we get to budgeting, and so there's gotta be a lot, so, if we can fit it in, we fit it in. Let me ask us to do this now, I got this note. Commissioner Rivers is ill, so may I have a motion to excuse him?
Second.
Proper motion is second that Commissioner Rivers be excused. Ready for the question? Please cast your
Yes.
vote. Commissioner
Yes.
Kicklight is yes, Commissioner White is yes. Okay, well, I have everyone. Now, there is a need for us to go into executive session, all right? So, we're going there for litigation, all right? I don't think there's no personnel that I know of, just litigation, right? Okay, so, yeah, they'll be back there, yeah. So may I have a motion to recess to executive session?
So moved, Mr. Chairman.
Properly motion is second that we go to
Yes.
executive session. Commissioner Whiteley votes yes. Commissioner,
Yes.
clear the board. That's all right. All right, now. Now everybody go again. Okay. 3. All right, we are in executive session.